Hi everyone, I'm Sneha. As a part of my B.Ed curriculum, here I have prepared a learning material based on an adolescent problem. And the topic I have chosen is depression. So, we all heard this word depression for many times. And essentially, the depression meaning. What do you mean by this depression? Is that it's a mood disorder which causes a persistent feeling of sadness and loss of interest. And this depression is also known as major depressive disorder or clinical depression. And it affects how you feel, how you think, and how you behave. And it can also lead to a variety of emotional and psychological problems. It causes feelings of sadness or loss of interest in activities that you have once enjoyed. It can also lead to a variety of emotional and physical problems, which will decrease your ability to function at work and at home. Now, depression can be mild and short lived, as well as it can be severe and long lasting. Some people are affected by depression only once, while others may experience it multiple times. The major problems caused by depression is that it leads to suicide. But this is preventable when appropriate support is provided. And it is important to know that much can be done to help young people who are thinking about suicide. Now, here I'm describing some of the symptoms of depression. These include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, also loss of energy or increased fatigue, as well as feeling worthless or guilty. Also, some of the symptoms are difficulty in thinking, difficulty in concentrating, or difficulty in making decisions. So, these are some of the symptoms. Now, when we come to adolescent depression, the adolescent depression signs and symptoms include a change from the teenager's previous attitude and behavior that can cause significant distress and problems at school or home, in social activities, or in any areas of life. Now, some of the emotional changes are feelings of sadness, which can include crying spells for no apparent reason, frustration or feelings of anger even over small matters, feeling hopeless or helplessness, irritable or annoyed mood, loss of interest or pleasure in usual activities. Also, they are having a low self-esteem. Also, feelings of worthlessness or guilt, frequent thoughts of death, dying, or suicide. These are some of the emotional changes which we can see in a depressed mind. Now, some of the behavioral changes are tiredness and loss of energy. If we see a person who is having a tired or he is having a lack of energy in doing activities, we can say that that person is experiencing depression. Also, insomnia or sleeping too much, use of alcohol or drugs, agitation or restlessness, for example, hand wringing or an ability to sit still, slowed thinking. Their thinking capacity will be very, will be slow, will be in a slow, and also speaking, slow speaking or body movements. We can see some of the behavioral changes. Also, frequent complaints of unexplained body aches and headaches, which will include frequent visits to the school nurse. Now, also, we can see poor school performance or frequent absences from school, less attention to personal hygiene or appearance. These are some of the behavioral changes we can see in a depressed person. Now, here I am detailing the depression in adolescence. Here, unipolar depressive disorder in adolescence is common worldwide, but often unrecognized. The incidence, notably in girls, rises sharply after puberty and by the end of adolescence. The 1 year prevalence rate exceeds 4%. The burden is highest in income and middle income countries. So the depression is associated with a substantial present and future morbidity and heightened suicide risk. The strongest risk factors for depression in adolescents are a family history of depression and exposure to psychosocial stress. Now, the major causes of depression are issues such as peer pressure, academic expectations, and changing bodies can bring a lot of ups and downs for teenagers. But for some teens, the lows are more than just temporary feelings. Brain chemistry. Now let's see brain chemistry. Neurotransmitters are naturally occurring brain chemicals that carry signals to other parts of your brain and body. When these chemicals are abnormal or impaired, function of nerve receptors and nerve systems changes, which will lead to depression. Now, hormones changes in body hormones can also lead to or which can trigger depression. Also, we say that early childhood trauma. So, traumatic events during childhood, such as physical or emotional abuse or loss of a parent, which can also cause changes in the brain that will decrease the risk of depression. Now, the last point is that learned patterns of negative thinking. Teen depression or adolescent depression may be linked to learning to feel helpless rather than learning to feel capable of finding solutions for life's changes. The risk factors of depression are having issues that negatively impact self esteem, such as obesity, peer problems, long term bullying, or academic problems. Also, having been the victim or witness of violence, such as physical or sexual abuse. Having other mental health conditions such as bipolar disorder or anxiety disorder, a personality disorder, etc. And having a learning disability or attention deficit or hyperactive disorder, having ongoing pain or a chronic physical illness such as cancer, diabetes, or asthma, abusing alcohol, nicotine, or other drugs. These are the risk factors of depression. It also includes family history and issues with family or others may also increase your teenager's risk of depression, such as having a parent, grandparent, or other blood relative with depression, bipolar disorder, or alcohol use problems, having a family member who died by suicide, having a family with major communication relationship problems. So these will also increase the teenager's risk of depression. Now, the complications of depression are untreated depression can result in emotional, behavioral, and health problems that affect every area of your teenager's life. Complications related to teen depression may include, for example, alcohol and drug misuse, academic problems, family conflicts and relationship difficulties, suicide attempts, or suicide. These are the complications related to teen depression. Now, how do we prevent depression? So, prevention is better than cure. So, take steps to control stress, increase resilience, and boost self esteem to help handle issues when they face. Also, practice self care, for example, by creating a healthy sleep routine and using electronics responsibly and in moderation. Also, reach out for friendship and social support, especially in times of crisis. We have to inquire help if we need. Get treatment at the earliest sign of a problem. That is to help prevent depression from worsening. Also, we can encourage our team to avoid relationships with the people whose attitudes or behaviors could make depression worse. Stay active. Participation in sports, school activities, or a job can help keep your team focused on positive things rather than negative feelings or behaviors. Ask for help. Also, we can provide continual warmth, caring, and support. Teach and model strong social and emotional skills. Also, encourage positive peer relationships. Encourage teens to seek purpose in life. Find ways to handle stress and improve your self-esteem. Take good care of yourself. Get enough sleep. Eat well and exercise regularly. Reach out to family and friends when times get hard. Get regular medical checkups and see your provider if you don't feel right. Get help if you think you are depressed. So, we have seen the major adolescent problems, depression, and its effects, how it affects a person mind, how it affects a family, and in turn a society. So adolescents with depression are at high risk for substance abuse and other psychiatric comorbidities. In addition, depression disorders with a pediatric onset tend to be more chronic and debilitating than depression beginning in adulthood. As a teen in the developmental stage, it is cardinal that they are receiving care and support from people. Without internal and external support, untreated depression can lead to serious problems and even medical issues if that be the case. Teen depression has been an ongoing issue affecting the lives of students academically, mentally, physically, and emotionally. So, these are the references. Thank you. Thank you all.